afternoon, everyone. I'm Ms. Charlotte, Director of Communications at the Mississippi State Department of Health. Today, the Mississippi State Department of Health is lifting its pause on the J&J vaccine. We'll talk about that. We're also going to talk about vaccine demand, and we will reveal the results of a COVID vaccine confidence study. We've been waiting a long time for that. Dr. Sutton will talk about that. I think 11,000 Mississippians from throughout the state answered the survey. Dr. Thomas Dobbs, our state health officer, will kick it off. Then we'll take the state epidemiologist, Dr. Paul Byers, and then over to Dr. Sutton. Hello, Dr. Byers. Hello to all of you, but Dr. Dobbs.
Hey, good afternoon, and thank you all for joining us. We look forward to this opportunity to give you guys some updates on much news relevant to the COVID pandemic and our efforts to get beyond it. Last evening, we distributed a Health Alert Network message to physicians, clinics, hospitals, pharmacies across the state, reinitiating our utilization of the Johnson & Johnson COVID vaccine. There are several components within that alert that I think are very important for people to know. As you're aware, CDC, with their advisory committee on immunization practice, just last Friday recommended resumption of the use of the Johnson & Johnson vaccine. The vaccine was associated with a very small number of rare blood clot disorders, especially for the veins that drain the brain. The number of cases that they had identified after additional research was 15. So out of 7 million or so doses of the Johnson & Johnson vaccine administered, they identified these 15 cases. Things that are important to know about this number of rare events is that it's been pretty much entirely within women, and primarily within women less than 50, and then concentrated in women in the ages of the 30-year age group. So it's a relatively narrow risk window. But the number of people, if we consider, is very rare. It's about 1.9 per million. And I would like to compare that with the rate of death from people diagnosed with coronavirus in the age group of 25 to 39. And within that age group, the risk of death is 1.9 per 1,000, right? Compared to risk of this rare blood clotting disorder, which is going to be 1.9 per million. So we're seeing several orders of magnitude difference in the risk. However, acknowledging that risk is there, we did send out guidance to clinics and physicians to, if they so choose, to offer Johnson & Johnson to their patients to, number one, make sure they're counseled on the risks, especially if they're under the age of 50 and women. Make sure that they understand that there are highly effective alternatives. The Pfizer and the Moderna vaccine are available if they choose to do that as a different choice. And give them the FDA EUA fact sheet so that each patient can have the information available to know what the risk is. Again, the risk is very low, but it is there. We want people to have information to make the proper choice going forward. So this was launched yesterday. So we anticipate that with these stipulations and these educational messages, that Johnson & Johnson vaccine will be available in the same places that we've distributed. We did receive about 90,000 doses of Johnson & Johnson so far. Throughout the vaccination campaign, we have about 40,000 doses that are unused on the shelf that are going to be ready for utilization within your local communities through the doctors and the clinics that have requested this vaccine. That's all that I have right now, and I would like to go ahead and turn it over to Dr. Paul Byers.
Hey, good afternoon, everybody. Thank you, Dr. Dobbs. Just to kind of give a quick update on where we are with COVID in the state. As you've all seen, we're reporting out over 330 cases today with an additional 5 deaths. Just a reminder that we are still seeing cases and transmission within the state. Although we have been in declines in our case numbers for a number of weeks, we are starting to see some minimal increases. If you look at our 7-day average of cases over the last few days, we are now up to about 240 cases a day, which is just a very minimal increase over the low 200s that we were in the earlier part of this month. We'll have to continue to watch this minimal increase to see if we can to see if we do see some ongoing sustained increases or not. But stay tuned. We'll be watching that with you. We are starting to see some declines in deaths that are continuing. This is important as we vaccinate the most vulnerable people of our population. And that's where we've seen most of our deaths in individuals 50 and older, especially in individuals 65 and older. And we have managed now in the state to vaccinate a little bit more than 70% of our individuals 65 and older with at least one dose of vaccine, which is very important and is one of those things that even if we do see some increases in cases, will minimize the impact in our most vulnerable population and limit the deaths. If you look at the deaths that we have reported over the last 2 weeks that actually occurred during that 2-week time frame, none of those individuals were completely vaccinated. So it's important for us, especially if you have vulnerable people within your population and within your family, that you continue to get them vaccinated. We are still seeing variants in Mississippi. Obviously, this is one of the main components of our surveillance now. We've identified almost 350 cases of variant strains of the SARS-CoV-2 virus in Mississippi to date. The vast majority of those have been the UK variant, which is now estimated to be the predominant strain in the US. We've seen over 300 cases of the UK variant in Mississippi. The good news is, when we talk about vaccination, is the vaccines that we have right now have been shown to be effective against the variant strains, and not only preventing infection, but more importantly, with prevention of the severe outcomes, hospitalizations, and potentially deaths that can occur as a result of COVID infection. It's going to be important for us when looking at our vaccination efforts to continue to push forward. Vaccine is the way for us to get back to a more normal environment in our daily life. In Mississippi, we have now administered over 1.6 million doses of vaccine. Of those, 940,000 individual Mississippians have received at least one dose of Moderna or Pfizer vaccine, or one dose of the Johnson & Johnson vaccine. Of those, an additional 769,000 Mississippians are fully vaccinated, which means in Mississippi right now, 29% of our total population in the state have received at least one dose. 24% of our total population throughout the state have now been fully vaccinated. We do watch and monitor the number of vaccines for folks who get one dose of Pfizer and one dose of Moderna, and then the number of people who actually complete that vaccination series. Right now, for the individuals who have received at least one dose of Pfizer or Moderna vaccine, 81% of them have received the second dose or have now been completely vaccinated. You need to understand that that number does include individuals in whom it may not be time for them to receive that second dose. If you recall, the Moderna second dose is 4 weeks after the first dose, and the Pfizer second dose is 3 weeks after the first dose. But it is of paramount importance for individuals who have received that first dose to make sure that they do complete that series. That's where the complete protection against infection and against the severe outcomes will be achieved, is by completing that vaccination. And I want to remind folks that even though there is a time frame for Pfizer and Moderna, for the minimum time frame to receive the second dose, even if you're late for your dose, even if it's been more than 4 weeks from your first dose of Moderna, it's still not too late to get the second dose. So please, if you've received the first dose of Moderna or Pfizer, make sure that you do get your second dose, even if it's after the recommended time frame. And Dr. Dobbs, that's everything that I had for this afternoon.
Dr. Sutton, would you talk to us about survey results?
Would be glad to. We had an opportunity, the State Department of Health in partnership with the Mississippi Community Engagement Alliance, funded by NIH, to complete a confidence survey. This was a statewide vaccine confidence survey that began around the end or beginning of the year, and we collected data until around the 1st of March. The survey is intended to be representative of Mississippians with intentional efforts to reach lower income, rural Mississippi populations, to include Black, Hispanic, our Latino, Latinx, as well as Asian, and with emphasis looking at our Vietnamese population on the coast, as well as Native Americans and Choctaw communities. The survey was translated in English, Spanish, and Vietnamese. And it was a convenience survey, mixed model survey, to include web-based, paper-based, and some verbal oratory type outreach to various communities. So we had over 11,000 Mississippians complete the survey, and we had representation in all the counties. We had the majority of women, around 70%, 71% complete the survey, and about around 29%, 30% for the men. We had great representation as it relates to the makeup of who completed the survey. We had white, Black, Asian, American Indian, Hispanic, Latino, Latinx. Some of the findings that I want to share with the survey has been, some of the key findings is that we found that 73% of Mississippians indicated they would definitely likely receive the COVID vaccine survey, COVID vaccine period. However, this was a little different and breakdown and changes as it relates to race and ethnicity. Asian Mississippians intended at an 80% level. White intended to take the vaccine around at an 80% level. American Indians around 66%. Latino, Latinx around 61%, and African Americans around 56%. And the vaccine intent gender was higher among men than it was women, around 78% and 68%. We did ask a question around political affiliation that we did not see a whole lot of variation in that. Those who identified themselves as independent, those who identified themselves as Republican, those who identified themselves as Democrat, and those who consider themselves, it varies and it just depends on the issue. We didn't see a big change in that. One thing I would like to point out as well, which I think was pretty interesting, is that although that we found that 73% of Mississippians intend to receive the COVID-19 vaccine, and when it's made available to them, it was only 52% that plan to vaccinate their children. And so, and this varied by race as well. Those that had intended to vaccinate their children when that becomes available, in our Asian community around 75%, American Indian around 57%, our white Mississippians around 55%, Latino around 54%, and our African Americans around 42, 43%. Another thing I would like to highlight is around key vaccination influencers. Who did Mississippians respond to if they were encouraged to take the vaccine, and around that? And so we found that, not surprisingly and been kind of consistent, around 60% of Mississippians would take the vaccine if they were encouraged by their regular primary medical care provider. We saw around 51% who were encouraged from CDC and our state health officer and the work and the messaging that has been done. And then we also saw that around 45% indicated if there was a close relative, father, mother, and so forth, that they were encouraged. We did see that from our survey that celebrities had less of an influence as encouraging folks to take or receive the vaccine. So, overall from the survey, just the high level points, Mississippians were most concerned about safety from the vaccine, side effects, approval, and just effectiveness. Looking at some of those issues were what Mississippians found to be very important to them. And, the reason for the study and the results was that this is going to provide some unique insight as we continue our outreach efforts, as we look at trying to build more trust and more confidence in the vaccine, and understand that for those in certain parts of our state, we need to make sure that we get the message out more and that we share more so they can make those decisions that's best for themselves and their family. And back to you, Liz.
Thank you so much, Dr. Sutton. It is beautiful. The executive summary is beautiful, and we will have that on our website after the press conference. Just go to the main COVID page, or you can go to our health equity page, and you'll see that, and then the full report. Dr. Sutton, am I correct? We'll have the full report by the end of the week.
Correct. We will have the full report by the end of the week. You have the executive summary, as Liz mentioned, at the end of the call.
Thank you so much. So we're going to go to the reporter questions. I'm trying to sit close so you all can hear me, and someone write me if you're not hearing my questions. All right, Scott Simmons, hello. Scott's with WAPT. Several clinics say they have slowed the receipt of vaccine because the demand has dropped off. Does the state now have a stockpile? Becker's Hospital review ranked the state 50th in vaccine administration. Why is the state lagging behind in getting vaccines out to people? Dr. Dobbs, would you take that?
Liz, I didn't hear the last part of what you said. Can you read the last part of that question, or maybe I can read it?
Yeah, we're using a new system, so everyone can't see the chat box. The rest of it was staff referring to a Becker Hospital review that ranked Mississippi 50th in vaccine administration. So he wants to know, why is the state lagging behind in getting vaccine out to people?
I see. I think it's a matter of looking at different things. I mean, you can parse it in different ways. If you look at the percentage of people over 65 who've been vaccinated, we're really quite in the middle of the pack, and I think we're doing quite well. That's going to be where our biggest impact is. We knew that we were going to have trouble getting younger folks immunized. It's the same thing that we have seen with flu shots and other things. So that's going to be a continued uphill climb, especially now that we're seeing pretty modest numbers of COVID and very few deaths. The urgency is not there, but the COVID pandemic is not over. We have variants coming. We have a good number of people who are non-immune, so we don't need to give up the fight. There are numerous sort of measures that we look at as far as our vaccine success. Number one is going to be protecting the vulnerable folks, and I think we're doing pretty well at that. Number two, though, is getting the broad population immunized. We're having a bit of a struggle. Again, it's not a surprise. We know that we live in a state that really seeks medical attention when people are sick. We have basically a state of illness, not a state of wellness. It's something that transcends even coronavirus. It's something that we need to work on. It's something it's rooted in our sort of healthcare traditions as far as how do we seek care. So it's not something that a catchy jingle on a TV commercial is going to make people go out and get vaccinated. It's a structural foundational challenge that's going to take a long time to work on.
Thank you so much, Dr. Dobbs. We now have a question from Maggie Wade. Hi, Maggie, with WLBT. Will Mississippi follow the lead of the CDC in allowing those who have been fully vaccinated to not wear masks in small gatherings? We've talked a little bit about this. Dr. Byers?
Yeah, absolutely. And we've been watching the CDC guidelines closely, and we did know that that CDC was going to come out with those guidelines, which they did do yesterday. They're reasonable. We have posted them on our website that individuals who are fully vaccinated can, if they are within groups of individuals who are vaccinated or within a group of people from the same household who happen to not be vaccinated, they can interact without a mask. But I think the take-home point in all of that is that the key needs to be vaccination. The key needs to be to err on the side of caution when utilizing a mask. When in doubt, when you're in public, when you're in a gathering, if you are not certain that everybody within that gathering has been fully vaccinated, and fully vaccinated means at least 2 weeks after the last dose in a series. It's not when you've just gotten one dose of Pfizer or Moderna. It's when you have more than 2 weeks after completion of the series. So you want to follow the guidelines, and the guidelines are good. But really, the key point and the take-home point in all of that is that vaccination is really where we need to be. And that's what's going to get us back to the point of being able to interact in small groups without having to wear a mask.
Thank you, Dr. Byers. The next question is from Nick Juden. He has a couple questions. First, can you break that 19% first dose category into those waiting to get their second shot and those who have effectively missed their second shot? Is that number increasing? Dr. Byers?
Yeah, we're looking at those numbers, Nick. That's a great question, and certainly that's the next step in determining the number of people who've actually completed the series. Is how many people are actually due for it now who are late, and we're working on teasing that data out of our system so that we can monitor that and take a closer look at it.
Okay, and let's follow up with vaccines. This is again from Nick Juden. Vaccines have dropped about 43% since the beginning of the month. We are seeing weekly declines of new vaccinations. How concerned are you about the slowdown of new vaccinations? Dr. Dobbs?
I don't think it's entirely unexpected. I would rather we not be trailing off. We still see the phenomenal value. We'll continue to work to get as many doses out there as we can. For the vast majority of Mississippians, it's not an access issue. There are more access points than there ever have been. So please, there's somewhere nearby you. But for some folks, there are access issues. And so we're working aggressively, setting up additional partnerships. We have a health equity team that's working on this specifically, especially for rural areas, underserved areas. So we're going to hit hard where we can. And then we just really want to get all Mississippians to get in the boat and kind of pull along with us in the same direction. It's not time to give up. And anything that anyone can do, everyone here today, please do your job, do your best to make sure that every Mississippian is protected against COVID who can be.
Thank you, Dr. Dobbs. Dr. Sutton, this next one's going to you. A PBS NewsHour NPR Marist poll shows over 40% of Republicans don't plan to get vaccinated. This political variation in vaccination intent is replicated in other surveys. Your study did not find any significant variation between political affiliations in vaccine. I don't like to use the word hesitancy. We're going to call it vaccine demand. What questions do these outliers raise? What might make Mississippi different? Dr. Sutton, can you take a swing at that?
Yeah, I'd be glad to take a swing at that. We looked at some of the national surveys and the survey that we conducted, and what we did find that there were a lot of similarities. A lot of it had that we found is the way some of the questions were asked and how we asked some of our questions. But and I'm sure Dr. Dobbs may want to chime in on some of this. And again, this was a convenience survey, so we did a really rich grassroots outreach to reach various populations. And a lot of the, and it was a huge number, again, 11,000 that we reached. So there was maybe some variation, of course, this as opposed to some of the methodology could have been a little different in saying that this was a convenient sampling. Dr. Dobbs?
Yeah, and we had 3 different categories instead of 5 categories, I think, in that sample. We had, unsure, yes or no, basically. So there'll be some variation in that just based on the way that those are categorized. The other thing is this is really specific to Mississippi, and I know there's different, dynamics within every state. I think that's worth taking into account. And in any of these things, there's also a significant margin of error, making sure that, like we see in a lot of surveys, there can be some range. if we look at the total numbers, they're relatively consistent. If you sort of compared them from our global sort of interest perspective. But I think it did demonstrate that there is demand from everyone across their political spectrum, but also there's a considerable number of people who are unsure. And we need to do everything we can to sort of reassure folks who are within that unsure category to understand the value and the safety of these COVID vaccines.
Thank you, Dr. Dobbs. This is from Alex Love and Dr. Byers. I'm going to have you answer this. What guidance is on this sheet to help patients with the J&J vaccine? And I believe we posted some of that on our website.
Certainly, there is some EUA or FDA guidance for vaccine recipients and for their caregivers. The most important piece is the guidance that does provide the recipient of the vaccine the information that there have been these rare cases of clotting with low platelets that have been identified in 15 individuals post-vaccination. The important piece of that is to make sure that people are aware of the small risk that has been seen primarily in women 18 to 49 years of age, but at least 2 cases identified in women over 50. But to make them aware of the very small risk and make them aware that in fact, there are other vaccines that are available and that can be utilized and are safe and effective, that if an alternative is preferred, to make sure that that patient is aware of the type of vaccine, the risk, and the fact that there are alternatives, so that if a patient can make that decision or the caregiver can help make that decision about whether or not they want to receive the Johnson & Johnson or move forward with a different vaccine.
Thank you, Dr. Byers. This next question is from Stephen with Super Talk News. Is the number of Mississippians not showing up for their second dose on par with national numbers? Dr. Byers or Dr. Dobbs, who wants to take that?
I can tell you before, I mean, the last data we had from CDC, it looked like it was on par with the rest of the country, a little bit better. I suspect it's about the same still. You know, we said we've got 81%, and we still have a substantial number of those folks who are still going to come back in. So I don't think it's going to be appreciably different than what we saw a couple of months ago when we had this going forward. I think people who understand the value of the shots understand the value of the second shot. And again, if you've had one shot and are behind, please go ahead and get it. You're still going to get that benefit. One shot is partially beneficial, 2 shots are fully beneficial.
And I agree, and I think by and large what we're seeing is that individuals who've received that first shot, even if they're late with getting the second shot, are completing the vaccine series. I think it's more important too to make sure that people understand that they got to get their foot in the door in the first place, and you got to get that first shot before you can get that second. So that's where we need to be focusing as well.
And it's important to remember too, the 2 doses of the Moderna and Pfizer are great protection against the UK variant and other variants we're seeing. Is that not correct? Okay, let's go to Connor with the Enterprise Journal. Are we seeing something of a plateau yet in Mississippi vaccinations? Percentages last week seemed to slow in some counties. Appointments that were running out in January seem to be staying available longer. What can be done to keep this momentum going? I think Dr. Dobbs, you somewhat addressed this. Dr. Byers, would you like to add anything?
No, I think Dr. Dobbs covered it.
Okay, thank you. All right, now we have a series of questions from Sarah with the Clarion Ledger. So, weekly cumulative vaccine doses have dropped from early this month, where doses given were in the hundreds of thousands, now to tens of thousands. What's behind the drop? Did the state hit vaccination peak in early April. And again, I think we've already talked about what I'll call confidence issues. So why don't we go to talking about the drop, Dr. Dobbs?
Yeah, so if we look, even if we look at the trust survey that Dr. Sutton referred to previously, I think it identifies stuff that we knew or thought might be true. If you look at people who are 65 and older, they are highly motivated to get immunized. Makes perfect sense. The death rate and the hospitalization rate is very high in the age group. As we move sort of down the age spectrum, right, we see less and less demand. And some of it's because it's our traditional sort of challenge, but the severity of illness is not going to be quite as threatening for a lot of folks. But I do want to reiterate that even if you're 25 to 39, it's still a 2 in 1,000 deaths and some hospitalizations. So there's still considerable risk. There is risk from long COVID, that would be prevented by not getting it from the vaccine. And there's also risk to your family and community. So it's important. So it's not unanticipated that as we sort of do the best we can with the older age groups, 65 and older, we're actually doing pretty good in 50 and older. But then as we get down to sort of like younger folks who are more healthy, it's going to take a little bit more to help them really understand what the benefit is going to be for them going forward.
Thank you, Doug.
And if I could add, Dr. Dobbs, too, I think it's important for people, especially those younger people, who think that they don't need vaccination because they were infected at some point earlier in the year. We still need people who have been previously infected to get vaccination. The benefits of the protection that can come from vaccination in many cases outweigh the immunity that you can receive from being infected. So just being infected previously is not a full protection. We encourage those people, even if you've been previously infected in one of those young groups, make sure that you get vaccinated as well.
Okay, thanks, guys. Dr. Sutton, this is coming to you. Also from the Clarion Ledger, a national survey last week by Morning Consult said 30% of Mississippians are unwilling to be vaccinated. What do you believe is behind the discrepancy with the statewide survey and the national survey? I would assume a big part of it might be the format of the survey and how the questions are asked. But Dr. Sutton, could you talk about that a little bit? I don't know if you've seen this other survey.
No, I think that was similar to the question that was asked before, and I think we kind of touched up on that way, and Dr. Dobbs touched on that as it relates to how the question is asked,
Okay.
and that this is a very Mississippi-specific survey.
Thank you. Okay, a little bit more from the Clarion Ledger. As COVID-19 variants, particularly the UK variant, rise in the state, who is most affected? What have the outcomes been like? Are people infected with variants more likely to be hospitalized or on ventilators? Can we trace any COVID-19 related deaths to specific variant types? Why don't I start out with you, Dr. Byers?
Yeah, there's a whole lot to unpack in that question. I have to tell you that, by and large, what we're seeing is no predominant race. Most of the cases are in adults. We're not actually seeing a whole lot of hospitalizations or deaths associated with the variant strains at this point. This is an ongoing collection of data, and we are still digging into the data right now as we get more and more reports of variant strains throughout the state. And certainly we're going to be making much of that data public moving forward so that y'all will have an opportunity to see the impact of the variant cases in the state. So stay tuned. As soon as we have that data mature and ready for publication, we will be displaying it.
Thank you. Anyone else want to add anything? Okay, so Kelly with WMC TV, I don't see a question. I just see your name, so send me your question. And we'll move on to Blake with the Northeast Mississippi Daily Journal. The number of COVID-19 vaccine doses in Mississippi dropped more than 19% for 2 weeks in a row for the weeks ending April 17 and 24. how concerning is this for our state? I think we've really, and talking about additional efforts, I think we've addressed that unless Dr. Byers or Dr. Sutton or Dr. Dobbs wants to add anything. Guys? Okay, so I inadvertently left off a part of Scott Simmons' question from APT. He did ask about a stockpile, about we have a lot of vaccine, like you said, we have 40,000 of the Pfizer right now, and we have certainly Moderna and J&J. I meant to say 40,000 of the J&J, but anyway, a stockpile, is that an appropriate word to use? I always think of a stockpile for more like our bioterrorism type things. Who wants to answer that? Thomas?
Yeah. So, I mean, we have vaccines sitting in doctors' offices, right? And so like when you do the flu, the doctors order all their flu vaccine and it sits there until people get the shots. So I think the thing to know is within your doctor's office, a lot of your doctor's office, they have vaccine waiting for you. So if you're not vaccinated, go there and go ahead and get it. Doctors aren't ordering more vaccine if they don't need it, but a lot of it have some on their shelves and it is readily available. Pharmacies too.
Thank you, Dr. Dobbs. This is from Bracy with NBC, and I'm glad you're on, Bracy, because I did want you to have an opportunity to talk to our team about this. Bracy wants to ask if MSDH or its partners have launched initiatives that would bring mobile clinics directly to apartments, neighborhoods, or other busy hubs like a barber shop, for example, in under-vaccinated communities. Dr. Sutton, I'm going to have you start with this. You lead the health equity branch, and you guys have done some amazing things. Can you talk a little bit about that?
I would love to, and the answer is yes. We launched an initiative in partnership with our community health centers around the state and other partners that if anyone wants to have a community event, a community vaccination event, we're open to it and willing to partner with apartments. And we have partnered with housing apartments around the state, faith-based organizations, community health centers, elected officials, and bringing the vaccine to your doorstep. Bringing it into the community, because I think that is what where we are now, and this is going to be, that's a key component. So any area of the state, any community, we're open to calling us on our hotline, and we get connected to the right person, and we'll start that process of planning a community event. And this is done in partnership from the coast to North Mississippi. And so we're excited about that and excited about trying to further address getting vaccine out to at the community level and with our community partners around the state.
Thank you, Dr. Sutton. And we're also doing centers of excellence that work with communities. We have pop-up clinics throughout the state that actually will go to homebound folks as well, and really trying to reach those folks that don't have transportation. Dr. Dobbs, anything you would like to add before I move on?
Yeah, no, we have recognized that this is the stage of the response where we need to bring vaccine to where people live. And, we have these opportunities and we're going to be adding more and more. So if you want to get a vaccination in your locale, please call the COVID hotline and tell, there's an option to select a community vaccination event. We are here for you guys. Just let us know where the vaccine needs to go and we'll get it there.
Thank you, Dr. Dobbs. And Dr. Sutton, this is coming back to you. With these survey results now in, does it change in any way the state's targeted approach to improve vaccine participation, and also any other takeaways that might be useful? Can you talk a little bit about that?
Would be glad to. I think it's a great question. I think what we found out is that we got to do more education around the safety of the vaccine, side effects, and the effectiveness. We're still dealing with myths. I know Dr. Dobbs and others address issues with women around infertility, and some of those things are still out there. And so we're still having to really educate the public so folks can make those decisions. We do know that as we look at vaccine possibly becoming available to, if I'm not mistaken, younger than 16, that we have to reach out to those parents of those teens. We need to get them ready and get them on board, because we saw clearly from the survey that there's some competence that we have to do in that area. It's one thing to deal with yourself. It's another thing to deal with your child. And so I think there's some opportunities that we need to look at moving forward. So again, and just to kind of echo as it relates to the survey that kind of teased out and brought more out, is that we're going to have to continue working with our trusted community partners. The survey tells us that who those influencers are, and I think we got to continue down the path that we just mentioned, working with our community partners and taking it to the doorsteps and taking it to the communities and making the vaccine available in environments that's really comfortable.
Thank you, Dr. Sutton. Kelly Cook, if demand doesn't increase, is there concern that the federal government will begin lowering numbers of doses for Mississippi? Dr. Dobbs, you want to take that?
We're not really worried about not having access to vaccine. So, we know that the supply is pretty robust in the United States. And fortunately, we're able to share some of our AstraZeneca with other nations. So I would just encourage everyone not to be worried about a lack of vaccines. There are going to be vaccines there for you. Our nation has done a phenomenal job, and we'll have enough vaccine for folks when they're ready to get it.
Okay, thank you, Dr. Dobbs. Dr. Byers, did we mention this question? I think you mentioned this. Have there been any deaths attributed to variant cases in Mississippi?
Certainly, there have been some deaths among people who've been identified as having a variant strain. I think we've identified 8 deaths among individuals with the UK variant. This is out of more than 350 cases of variant strains that we've identified in the state. I just want to remind that the vaccine is protective against the variant strains. The way that you address the variant strains is the same way that you address any strain of COVID-19, and that is making sure that you get vaccinated, make sure that you're using appropriate source control with physical distancing, limiting large groups, making sure that you're wearing a mask when appropriate. And those are the ways to effectively prevent a variant strain as they are with any other strain of COVID-19 that we're dealing with right now.
And I don't know if we know this, of those variant deaths, were those folks fully vaccinated?
No, they were not.
Okay. All right. I'm sorry. I thought that was important to ask that. All right. Let's look at Sabrina Robertson, the Natchez Democrat. On Tuesday, Adams County total showed 2,473 cases. And today it shows 2,505. Many are concerned about the apparent surge of 32 new cases, but it is unclear how many of these are active cases. Officials are considering whether or not to lift our local mask mandate. Can you address this change? Is there cause for concern? Dr. Byers, can you get that?
Absolutely. And, many of the cases that we're seeing in that area right now are related to a large outbreak that we're seeing. Not all of these cases are new that have occurred within the last couple of weeks. We anticipate that we're going to continue to see cases. And even if there's an outbreak that's associated, remember that it's important for the whole community to be aware, to make sure that they're and understand that there still can be community transmission within place. So even if we're seeing an outbreak, we still want folks to be able to take those appropriate precautions. This is an outbreak that we're working with the facility, and we're watching it closely. And one of the things that we want to do, even if there's an outbreak, is make sure that we limit that impact on the larger community.
Thank you, Dr. Byers. Nick Juden is asking, increasingly, scientific observers are calling to reassess our understanding of the primary model of COVID-19 transmission. We have operated for most of the last year with the assumption that droplets are primary, airborne secondary, and contact is tertiary. Are you familiar with the emerging arguments that airborne transmission is primary, above and beyond droplet transmission? Dr. Dobbs, can you talk to that?
That's something we've embraced for a long time. When you look at these super spreader events, it's very clear that it's going to be an aerosol sort of airborne transmission route, right? So I don't think it changes any of our approach. We've realized that that was a major mode, if not a primary mode in certain circumstances. Within a household, I think it maybe seems a little less relevant where you are going to have droplet exposure too. But in a larger community, yeah, that's why the masks make such a big difference. Because you're going to be, you're not going to be in close proximity to the person who's going to infect you. So, it makes sense. I think it's been a debate that's been raging for a while. But I think it's important not to get too distracted by the minutia. We know that that aerosol transmission is a huge driver of spread, and we know what works. And right now, it's mostly the vaccine is number one, and then masking and social distancing are still going to be effective. But the main thing, if we can just get everybody vaccinated, then everything else is really not relevant.
Maggie Wade from LBT is asking, most people are starting to travel. What is the advice to Mississippians with summer vacations coming up? There still seems to be some concern that we are letting our guards down too quickly. Dr. Byers?
So first and foremost, the guidance and advice needs to be to get vaccinated if you're eligible. That's the best way to travel safely. CDC does have some guidelines for travel, and certainly there are some relaxations among the travel guidelines now for individuals who are fully vaccinated. I think it all comes back full circle to everything that we talk about is that vaccination is the key moving forward. But by the same token, it's not time to completely dismiss all of the activities that we've been doing this whole time around. Even if you're vaccinated, wear a mask in appropriate situations. If you're not vaccinated, make sure that you are planning to get vaccinated, but also use mask and physical distancing appropriately. And we're still seeing transmission, guys. We have started to see a little bit of a surge in cases, although it's not much. We're still seeing deaths in Mississippi. We are, like we just talked about, still seeing isolated outbreaks in Mississippi. So we are not done with this pandemic yet.
Thank you, Dr. Byers. Jackie from Fox 13 in Memphis is asking, are you concerned that we could see a fourth wave in cases if not enough people are getting vaccinated? I think we've talked about our focus moving forward. Could vaccine sites close if the state is not distributing enough vaccines? Dr. Dobbs, we don't have Jim Craig here today. Can you talk a little bit about that?
Sure. So, where we're seeing less demand, we are transitioning our strategy. So we're moving more and more locations indoors. We're doing more just sort of walk-in clinics. We do have Mr. Craig is actually coordinating an 18-county blitz where we're spending a week there doing walk-in clinics. We're having Saturday clinics. We're going around doing nursing homes, correction centers, homebound folks, comprehensive. So we're changing our strategy to where the demand is. Will there be less and less days at our big drive-through sites? Yes, that's inevitable. But it's also an opportunity to sort of shift our resources, some of the smaller areas, harder to reach folks, more and more homebound individuals, so that we can sort of get that last mile and get us across the finish line as much as possible.
Thank you, Dr. Dobbs. And Dr. Sutton, I'm going to start with you on this. How much headway are you making in reaching homebound and those without transportation? And actually, Jim Craig, who has led our vaccine effort in the field, is doing all these pop-up clinics that are dealing with those that are homebound. In fact, Dr. Dobbs, I think you went out and actually vaccinated. So anyway, they're talking about mobile units to rural areas. Dr. Sutton, first you, and then Dr. Dobbs, you can talk about your experience.
Just real quick, we're getting great participation around the state in rural areas. We've had requests in a lot of different places that are rural, so we are going out to those rural areas. We are having events in those rural areas. We are working, have an increased effort to work with business and organizations to work and partner with them in rural communities to host events for folks that are working. We had an event today, actually with Jeff Good, who with restaurants and other employers who were able to actually get vaccinated and then go back to work. And so those are unique partnerships that we're looking at, and we're looking at those unique partnerships around the state. And so we're going to be looking more to industry and business leaders to partner with them to vaccinate folks in rural communities around the state.
Thank you, Dr. Sutton. And go ahead, Dr. Dobbs, talk about your experience. I think it was was it in Bolton?
Yeah. So, we have identified folks who are homebound as a real important group of folks who need service. And I had the opportunity to go to Bolton and then into the city of Jackson to vaccinate folks who are homebound. It was really edifying. Now, we have several things going on, right? So, number one, we have these 18 county efforts to make sure that working with the local emergency management agency to get as many homebound folks as we can, working with our local partners. Our centers of excellence and have stepped up and done homebound. We also are going to be setting up more and more partnerships. We're working on that today, so stay tuned where we're going to recruit other folks. And the other thing is we do have an email. It's covidhomebound@msdh.ms.gov, where people can say, I'm homebound and I need a vaccine, or someone can do that for them. And we'll make sure that they're connected with the resource, or we'll do it ourselves. So we have a lot of things going on because every community has a different set of resources. We will get to every homebound person who wants to be vaccinated. So if you know somebody who wants to get vaccinated and they're homebound, please send us their name and information to covidhomebound@msdh.ms.gov.
Thank you, Dr. Dobbs. Michaela Morris with Kaiser Health News. Hi, Michaela. With the survey, so Dr. Sutton, this is coming to you. With the survey, was there a difference in vaccine intention between urban and rural counties in the intent? What efforts are planned to connect with parents and teens on vaccination? Why don't we take the first one and then we'll go beyond that. So let's talk about the intent between the urban and rural counties. Dr. Sutton?
Yeah, I think that's a great question. And we're going to have to do a deeper dive and just kind of define what we're talking about with urban and rural and looking at that and teasing that out. But what we did do is that we did pull out the 18 Delta counties, and we did see some variation as it relates to where we had statewide 73% that had vaccination intention among Mississippi adults. In the Delta region, we had about 60%. And so we did have some variation there. A lot of it was a lot similar. And even with the key influencers, we had the same influencers statewide as we did just in that particular area as it relates to your medical care provider, as it relates to state health officer and CDC as being key influencers and close relatives. So we had some similarities, but we did have some variation in those counties, particularly looking at the Delta region compared to the entire state.
And Dr. Sutton, I haven't read the whole report. Did you talk to parents, and you might have mentioned this, did you talk to parents of teens on whether they would get their children vaccinated?
We did. We found that looking at the parents as it relates to their plan to vaccinate their children, it was more around 52%. And so I think there's some opportunity there. And we're going to work with Liz and the communication experts and look at devising ways to do outreach efforts to that group.
Yeah, I would say to you, Michaela, our efforts really have focused on those 50 and older, and especially those 65 and older, and those with chronic diseases, those that would have the highest mortality rates. But we will certainly shift our vaccine vaccine campaign efforts when the time is right. And let's see, from the Meridian Star, let's see, in Neshoba County, only 19% of residents have received at least one vaccine dose, and 16% of residents are fully vaccinated. Do you know why Neshoba County's vaccination rates are lower than most counties in Mississippi? Dr. Byers?
Yes, thank you, Liz. And no, that's a good question. And certainly, Neshoba is one of the counties with the lowest rates. I'm not certain that we have complete clarity about why Neshoba County is lower than others. Certainly, we are working to make sure that vaccine is available in the county through a number of different facilities, including, clinicians' offices and pharmacies. And certainly we need to continue to work with why Neshoba County is low. Certainly that'll be a target for one of our special clinics to address vaccination efforts in reaching the community. But we still have work to do. And Neshoba is not the only county that has lower rates. And if you look at our map that we published today, you can see that there are some counties that have significantly higher rates of vaccination for both first doses and fully vaccinated than the state rate. So, there's lots of work to do as we continue to ferret out these areas where we have lower vaccination rates. That can be through hesitancy. It can be through the fact that it's not convenient. It may be through the fact that they just haven't had an opportunity to get vaccinated yet. And so I think there are still many barriers that we have to overcome. Dr. Dobbs, did you have anything that you wanted to add to that?
No, except for there are some parts of the population that are not making it into our database, right? As far as federal sources of vaccine. And so that's another thing sometimes that is an issue, whether it's going to be through the Indian Health Service or through the VA. We don't have full visibility. We have a broad number, but we don't have visibility about by county where those folks are. And I don't know if that's an impact also.
Thank you to both of you. This is from Nick Juden. Dr. Dobbs, you said there are no remaining access issues because of the widespread vaccination locations. Are there really no remaining access barriers? I've seen you traveling to deliver vaccinations on location. Is there more that can be done to reach out to individuals who cannot make it to the state vaccination sites? I believe we are going to them, are we not?
Yeah, no, I didn't say there's no access issues, right? I said there aren't many access issues. I mean, the availability, it's the same thing. I mean, pretty much in every county, there are multiple locations to get vaccinated. It's in numerous pharmacies and places. So anywhere someone gets healthcare, pretty much you can get a vaccine, right? But that doesn't mean there's not a challenge. Think about the flu shot, right? It's the same thing. Now, the flu shot's important. And it's broadly available, the same thing. But even with the flu shot, there's going to be access challenges because people don't have transportation, that sort of thing. We're going to do everything we can to get around it. But I do want to reiterate that this is really a state issue. We are in a state where there are super health challenges. This transcends COVID. And so please, let's think about this holistically going forward about the health and well-being of the state. This isn't a Department of Health problem. This is a state of Mississippi problem. And we all got to work together to fix this.
Dr. Sutton, our health equity leader, do you have anything to say?
No, I think Dr. Dobbs hit the nail on the effort. There's a certain thing that we call social determinants, and there's issues that folks are faced with, and transportation issues and other issues that come up. And so I think, I don't want to belabor the point, but there's natural barriers that's in place that we as a state that existed way before COVID, and that we're trying to deal with on a continuous basis, just for overall better health.
And hopefully a lot of these efforts will guide us in any future outbreaks and, God forbid, pandemics or anything else that might come up. We can, I think, truly learn from what we've done and apply that. Let's see, how do you determine where MSDH will go to give vaccinations to those who are homebound? Any plans to come to the Pine Belt?
Yes, I mean, wherever they are, we're going to connect them with the resource. I think it just depends on what that local resource is. I want everybody to know that, the health department, which has about 5 doctors in the whole building, is but a very small piece of our healthcare infrastructure. We have thousands of doctors, hundreds of hospitals, and we have a fantastic network. So we're going to work with this healthcare network to make sure we bring local resources to have success. And where those are not available, we'll make sure we're going to go everywhere. Anywhere someone needs a vaccine, it may not be tomorrow, it might not be next week, but we're going to spend every effort. We'll make sure everybody who needs a vaccine, if we have to get there by dog sled, we'll get them a vaccine.
Thank you, Dr. Dobbs. And Scott, I am keeping this press conference to COVID, and you can certainly write me offline. Lauren, with the Sun Herald, with tourism and travel up the coast and across the country, and many people eager to have a normal summer, can you advise of any of the activities that should still be avoided, or what precautions people should be taking even after being vaccinated? Kind of like the last question, are there certain activities, y'all, like swimming? Would that be, if you're fully vaccinated, would that be safe to do? Because you're not going to have masks on, obviously.
Yeah, I think that CDC's done a pretty good job of giving us some broad sort of framework to understand. If you're outdoors and you're not crowded around a whole bunch of people, like at, like a rock concert or something like that, you're okay, right? So anything that you're outdoors and you can do with fully vaccinated with some space, you're good to go. Crowded indoor situations are going to be a little bit dicey still, because we know the transmission within those closed environments is really kind of a high risk situation. So yeah, follow the principles. I think CDC's done a good job, and I would expect to get additional guidance from them going forward. We're really happy to see some sort of, really common sense but comprehensive guidance that we can use from CDC, and that's what we're going to base a lot of our recommendations on. Thank you, Dr. Dobbs. Dr. Byers, anything you want to add?
No, I think Dr. Dobbs covered it. I think that the key that we keep talking about is basically to look at CDC's guidelines. If you are in a crowded area, especially with poor ventilation, and you're not with individuals who've been fully vaccinated, or if you don't know, again, err on the side of caution and utilize those principles we've been talking about. But I think as we get more and more people vaccinated, and CDC has demonstrated this, as we get our vaccination rates elevated, we get more people vaccinated, that the restrictions loosen. And I think that's what we need to continue to work towards.
All right, thank you, Dr. Byers. I want to repeat that address for homebound. It's COVID homebound at msdh.ms.gov. Now, Kayla is saying that from WDAM that is out in the Pine Belt is very rural, and some folks don't have internet access. Would that be the hotline, Dr. Dobbs?
No, not yet. This is still in evolution. Someone can put it in for somebody, right? So we've seen doctors put it in for their patients. We've seen neighbors. So please, for now, use the email if you have somebody. But we are recruiting additional assets that will be locally available, and we'd like to have a phone number for each of our local assets that you can call directly and set up a vaccination appointment.
Thank you, Dr. Dobbs. I don't see any last questions here. Dr. Byers, closing comment?
I think we've said it. Get vaccinated. Now's your opportunity. If you're waiting and seeing, the time for that is past. I think that if we want to continue to move forward with continued opportunities and to reduce our cases and the potential for deaths and hospitalizations, now's the time to get vaccinated.
Thank you. Dr. Sutton?
I think everything has been said pretty well as it relates to questions, but I would implore our folks that are on this call to reach out to the community. And if there's opportunities that we can work and partner with the community to direct them to the health department, we're willing to come to the community to provide the vaccine, work in partnership with our community health centers to make that available, work with our operations team, Mr. Craig and the guard, to bring vaccine to the community. So as much as we can work and partner to address as many barriers as we can, the health department is here to do that and take it to the community. Thanks.
Thank you. And Dr. Dobbs?
Y'all, we're doing well. We're making progress, but we're not there yet. We're seeing more and more limited restrictions, more and more safe activities, but we've been through a lot of roller coaster moments. And every time things get better, there's a tendency to overreact and try to throw all caution to the wind. We are making progress, yes, but please show a little bit of patience, whether it's in your own personal life about avoiding crowded indoor situations. Getting vaccinated certainly is the best thing we can do, or keeping our kids safe in school, right? We know that our protocols currently work quite nicely. We want to keep our kids educated. So be patient. Let's use those systems and approaches that we know are effective to get us through this pandemic. Let's not jump off the roller coaster just because we think things are looking pretty good right now.
Thank you, Dr. Dobbs. I do have one last question. I have been sent pictures of restaurants and stores in central Mississippi which are banning masks from inside their locations. Can you speak to the danger of that? Is that even legal? I hadn't even heard about this. Any of you all heard about this?
I'm not sure what that is. I'll have to say it seems pretty crazy, but I've not seen it.
Yeah, it sounds very crazy. Nick, if you want to get with me offline, I'll be happy to talk to you, but we certainly hope all of our restaurants are wearing masks and following all of our guidelines. We appreciate that. Also, I wanted to thank you all for remembering that any site where we're administering any kind of public health activity is protected by HIPAA. So if you want to get pictures, you have to stand off the premises and get wide shots, but you can't get any identifying pictures. And also, this press conference will be posted on the website in case you needed to go over any numbers or anything like that. So for now, I'm Liz Charlotte saying thank you, and we'll see you next time.
Thank y'all.